Hi there. Here at Healthcare Compliance Pros, we talk to hundreds of healthcare organizations every year, and one thing that we have found is that most healthcare facilities don't realize that they don't have a sufficient program in place. Let's take a look at a couple of things a sufficient compliance program should include. We have found that 74% of healthcare organizations don't know the full scope of regulatory compliance standards that they are expected to meet. And while training is important and that is foundational, there are other things that you will need to include in your program in order to hit a sufficient standard. Things like assessments, reporting, checks, policies, and a way to keep your program up to date annually. These things are not just best practice, but in many cases are required by law. For your HIPAA program, you'll want to not only have sufficient HIPAA privacy and security training modules for your employees, but you'll also want to do some additional things like track your business associate agreements and expiration dates, ensure that you're going to perform a sufficient security risk assessment. That can include things like inventorying where your PHI and EPHI are going to be stored, and that you're covering the full scope of all 6 sections that are required by the National Institute of Standards and Technology. You'll want to track both HIPAA breaches and potential breaches, as well as ensure you have implemented a solid and thorough disaster recovery plan. If you handle Medicare or Medicaid, the federal government has required that you implement a corporate compliance program. Some of the things that will detail include OIG exclusion checks every month, where you can check employees, vendors, business associates, and volunteers against the OIG exclusion list, holding frequent compliance committee meetings, and as well training on Stark and anti-kickback, fraud, waste, and abuse, and whistleblower statute. This will ensure that your employees understand the repercussions for fraudulent behavior with federal money. For your Osha program, you'll want to have a few things in place, such as keeping an active SDS binder up to date, performing your hazard risk assessment, and providing training for your employees on general safety, bloodborne pathogens exposure, and handling hazardous waste. When it comes to human resources, tackling things like social media policies, cell phone use, employment law requirements, and as well providing additional resources and courses for your employees to train on things like state specifics, sexual harassment, and others. So I'm not compliant, so what? We hear that question quite a bit. The issue is compliance brings heavy penalties. $5.5 million is the average data breach cost in time, mitigation, fines, and as well lost patients' confidence. And the things that you could be responsible for if you're found out of compliance could be fines, could be findings, and even in some cases jail time for administrators and providers. The reality is, if you're a small to medium-sized healthcare organization, the risk of facing a random government audit is much smaller than a large organization. However, small to medium-sized practices are at a greater risk of audit due to a disgruntled employee or a dissatisfied patient. In today's environment of informed consumers, the most effective way to mitigate these risks is to take a proactive approach. Here at Healthcare Compliance Pros, we've developed a solution to not just tackle training, but as well implement all of the extracurriculars that you'll be required of as a healthcare organization. We want to help you, and we've helped thousands of customers nationwide so far. Give us a call. I'd be happy to sit down and talk with you to see what kind of a solution we can come up with for you today.